Well, hello again. I just wanted to update you guys. I had my Venogram yesterday and I was gonna post a video, but yesterday I was kind of out of it. Um, One thing that I experienced yesterday and am very still agitated over is the fact that we individuals know our body more than anybody else. And when we are experiencing something and we know exactly the reason behind it and we're vocalizing that and I'm being told something else, it is very frustrating. So, I have mast cell activation syndrome. I went over my allergy list like several times yesterday with not only every single nurse that took care of me, the residents, the anesthesiologist, the doctor, everybody knew across the board my allergies. Everybody knew. So I pre-medicated with prednisone, Benadryl, and ephedrine to reduce my reaction to the contrast dye that they use for the Venogram. So the Venogram, they went through my groin and they took pictures of kind of the blood flow, the restriction, and confirmed that the nutcracker syndrome was present through my renal vein. I don't know really all that they confirmed other than that the compression is there and that surgery is the best option to relieve kind of that pelvic floor pain that I get, the kidney infections, and kind of that bladder issue when I run, as well as just in general. So I'm trying to think of the best time to do that. I'm probably going to try to schedule it in between my graduation date and kind of starting my nursing degree. So, or path. So that's kind of where I'm at with that. So I'm probably going to be scheduling it end of August, beginning of September. Don't know recovery time yet. But it's just kind of where I'm at with that decision. But so as they were going in, I could feel the pressure of the catheter going in my groin and it wasn't that painful. I guess I showed a lot of anxiety with the contrast that they were talking about using, and that's fine. So they tried sedating me with more Versed. And Versed is a benzodiazepine and it's kind of just helps you relax. Well, I started getting this really bad tightening in my chest and I kept verbalizing that. And all they kept telling me was, you're just anxious, take deep breaths. And I said, no, I'm alert. I'm having a reaction to something and I need you guys to listen to me. So they again brushed it off like it's no big deal. You're just having anxiety. Don't even worry about it. It will go away. Just take slow deep breaths. And I was so agitated with the anesthesiologist because she just wasn't getting it. I know my body was reacting and I know it was a contrast. I really absolutely without a doubt know. So they gave me some IV Benadryl and they gave me some Ativan and they gave me some more Versed. So I'm pretty out of it still. But the second that pain was even more intensified, I was alert, I was aware, and I was in so much pain. I was by tears. I was crying. And I kept telling them, it's not my anxiety. I know what anxiety feels like. I'm breathing really fast. I have that tightness in my chest. Can you please just understand? Again, I was brushed off like it's no big deal. That agitates me more than anything. You should listen and advocate for your patients, no matter what the situation is. If they are having anxiety, do not tell them to calm down just to take deep breaths. You need to focus on what is causing their disruption and what is causing them to react, right? And kind of don't just brush it off. Oh, she just has intolerances to medication, just some adverse reactions. It's no big deal. She does have mast cell, but it will go away. Let me tell you, this is one reason why I'm getting in the medical field, because advocating for patients, especially individuals like me who have high allergy risks and have high risk potentials for reacting to anything at any given point because of my body being at a high histamine level all the time, is very important. And I can't stress that enough. So last night or yesterday after I got home, my face was swelling and I felt kind of miserable, just very weak. I took a nap and then my muscles started aching, and that's also a sign of how my body reacts to contrast. So I was supposed to go back to work today. I wasn't feeling strong enough and I've been really, really weak, and having that muscle, I feel like all my muscles have just been really, really tight. I still kind of have facial swelling in my lower cheeks and my jaw and my throat, and that's just what it is. I'm very pale. I'm very not myself, but I'm gonna get through it. My blood pressure's been dropping, so I've been trying to eat as much as I can when I can, as well as drink fluids. But if you are ever in the medical field or a patient, make sure that you hold your voice strong and you listen to your patients, because 90% of the time they're right. So that's just my 2 cents, and I hope you have a wonderful day.